A very good afternoon to all my viewers out there. Today we will be talking about understanding hypertension. But first, to know about hypertension, we need to know what is blood pressure. Pressure is the pressure that is exerted by the blood against the arteries while it flows to the arteries or the big vessels of the body. Now this is the normal pressure which we all have, which we all experience throughout the day, and in a normal person it rises and falls throughout the day, and it is a normal diurnal variation of which is a physiological phenomenon. Now if this pressure of this the flowing blood against the arteries is persistently raised, then it is known as hypertension. And as we all know, millions and millions of people every day all over the world in both developed and developing countries are being diagnosed with hypertension. And it is not only a silent killer, it is organ damaging and also a debilitating disease causing lots and lots of problem to the human beings. Now, what causes hypertension? Hypertension is a multifactorial disease which can be due to age and various other factors which are lifestyle related. It can have a genetic factor also, which is widely being studied. But for general mass classification, hypertension is of two types. One is primary hypertension or essential hypertension, the hypertension of the masses. That is 90% of the people are being affected by this hypertension, and it has usually no cause, but it is multifactorial. As I said, genetic, the age-related stiffening of the arteries, the smoking-related thickening of the arteries. It can be due to the diet-related factors like high sodium content in the diet and low potassium in the diet, and various other factors, and most importantly stress may lead to hypertension, which is essential hypertension. Another hypertension is a non-essential hypertension or secondary hypertension caused by any disease of the body, which can be an adrenal disease, Takayasu's arteritis, or constriction of the aorta. It can be due to arteriosclerotic disease of the kidneys and various other causes like hypothyroidism and various other causes. But it is usually affecting the 10% of the people. Less 90% are affected by this essential hypertension, which can be easily managed by various forms of therapy, which I will come to later. Then going to another form of hypertension, which is resistant hypertension, which is usually resistant to forms of therapy, that is drug therapy. And another is malignant hypertension, when the person has a high BP of systolic BP of 180 mm of mercury and a diastolic BP of 90 mm of mercury, and it has causing organ damage, that is eye damage, kidney damage, then it is known as malignant hypertension. And another new term of hypertension is isolated systolic hypertension, that is the DBP, that is the diastolic blood pressure remains below 90, but the systolic blood pressure rises above 140 and it carries a risk of stroke. Another classification of hypertension is that is normal hypertension, that is when the SBP and the systolic BP is less than 120 and the diastolic BP is less than 80. Then elevated hypertension, that is when the systolic BP rises above 120 and keeps below 129 and the diastolic BP is still below 80. Another is stage 1, that is when the systolic BP is above 130 to 139 and the diastolic BP is 80 to 89 millimeters of mercury. And when you call it the frank hypertension or the stage 2 hypertension, then the systolic BP is above 150 and the diastolic BP is above 90, and then it warrants therapy. What forms of therapy we should go for? Because we know that hypertension is a silent killer, and most of the hypertensives present to the doctor at a very late stage because it presents with very less symptoms. Maybe some amount of headache, some amount of vertigo, some amount of nausea, vomiting, but usually people tend to overlook this because they are not very specific symptoms. Though it is very easy to diagnose, but it is diagnosed very late because it lacks specific symptoms, and so it is a silent killer. By the time it is diagnosed, it has damaged many organs like heart, the kidney, the eyes, so it should be diagnosed early. How to diagnose early? Report to your doctor at earliest of any symptom appearance, or during routine checkup you should ask your doctor to check the BP, because if there is any raised BP, it may raise the suspicion of hypertension. And early diagnosis and early treatment may help in saving any life-threatening after effect of hypertension. Now, how to decrease this hypertension? One, aging we can't prevent, but what can we prevent? That is our lifestyle modifications. What lifestyle modification? Exercise. A healthy heart creates less pressure along the arteries when the blood flows through that arteries. So we should try to maintain a healthy heart. And how do we maintain a healthy heart? It is by exercise. Exercise helps in maintaining a healthy heart, and we should keep our weight in check so that hypertension doesn't develop. Second, diet also plays a very important role. Vegetable rich Mediterranean diet and a low sodium diet is very important in maintaining a healthy heart. A low sodium can helps in decreasing the BP. But how can we decrease the sodium intake? Indian foods are very rich in sodium, so we should decrease our daily salt intake. We should also, while buying any packaged food, we should look for the sodium content. And also fried foods, we should avoid eating much of fried and spicy food. And we should take diet rich in potassium, which may help in maintaining a very good BP. Second is smoking. Smoking is a very important lifestyle modification. Leaving smoking is very important because smoking decreases the NO in the blood vessels and causes vasoconstriction, which causes a rise in BP. Secondly, self-monitoring of BP at home is very important because always it is not possible to visit a doctor to monitor your BP, and self-monitoring of BP can help to check the early rise of BP to a very good extent. But we should not also forget one thing, that we should be compliant with our doctor's advice. Self-monitoring, only with self-monitoring, if we think that BP has dropped down, we should not stop taking the drugs or stop taking the measures that our doctor has suggested, because BP, once a hypertensive, he or she may remain hypertensive for life. So we should maintain that. Another thing which is very important in our regular life, in our day-to-day life, is stress. We are very stressed out. Doctors, all the common people are very stressed out in this rat race of life. So we should decrease the stress and maintain a specific period of sleep daily, take rest daily, do yoga daily, so reduce our stress. And also, last but not the least, we should consult a doctor and start taking medications whenever our BP is high, because along with these lifestyle modification measures, these drugs are also very important. Any sort of drugs which our doctors prescribes, we should take them without any fail at the regular time of day, and we should not stop them in our own consent. We should take the consent of the doctor, then only stop the drug. That will help to control our BP and prevent this ongoing epidemic which we are heading into, this epidemic of chronic disease, that is the hypertension and the diabetes mellitus. Thank you.